We're going to the Bridger Teton Wilderness in Wyoming, and we'll be hunting up to elevation around 11,000 foot. And if you get some snow, that makes it even harder to climb up the mountains. And it's very strenuous, very tough, and I'm going with my son this year, and so excited to get to go with him again, because once you get old enough, that high altitude, you're just not going to be able to go up there forever. And when I started having all this knee pain, I was afraid that this day would never happen. Every step I took hurt. I couldn't, just couldn't negotiate anything that had any incline, and it hurt worse going downhill than it going up. And those little handicap ramps are not that steep, but I couldn't walk down one of those without severe pain. Because I was a little nervous about having this done and didn't really know what to expect, but when we went to that education session that they require you to go to, you just felt at ease when it was coming, because they went over everything about how long the surgery would take and how long you would be in the operating room, the recovery room, and when you would get back to your room and when they'd come start doing the rehab with you. When I left there, I wasn't worried at all about it, because I knew everything was going to be already taken care of, and I wasn't nervous at all when I went up there for the surgery. I don't remember going into this operating room, and the next thing I remember, I was waking up and it was over with. And then they took me back to the room, and my wife was there, and she was very surprised at how well the nurses took care of me. With when I did get a little sick at my stomach, they were right there on the spot, and if you had any questions, they'd answer any questions you had and any questions she had. You just don't get that kind of care, in other hospitals. And it's just amazing what the technology that they've got there in that center is as good as any hospital in the United States. They exceeded all of my expectations. They had told me that with a total joint replacement, if I got 120 degrees bend in my knee, would be good for total joint, and I was determined I was going to get that. And when I finished, they measured my bend, and I'd actually got a little over 136 degrees bend in my knee, which was just outstanding. I have a friend here where I live now that had gone to Plano, and he struggled with his knees that he had done in Plano. He seems to be doing pretty good now, but he was amazed at how fast I recovered from my surgery, and I count all of it to the physician in that total joint center and doing what they set out for you to do. After I had the knee replacement and saw how well I was doing, I booked a hunt with the outfitter, and we're going this year on the 24th of September. I'll leave to head up in that high country again, so my son, we're excited about it. It doesn't matter if we see an elk or not, just being up there in that country with him and together with him, kind of a father-son deal, it's worth the trip of a lifetime. And I can't see any reason anybody in West Texas would go to Dallas or Plano when they have that total joint center right there in Midland, Texas.